The pharma company Abbott Laboratories says it's created a new portable coronavirus test that can deliver results in minutes rather than days. So how does it work? Does it work? We've decided to find out live on air tonight. Dr. Michael Misialek is Associate Chair of Pathology at Newton-Wellesley Hospital outside Boston. He'll be performing the test on this show's chief medical contributor, Dr. Marc Siegel. Dr. Misialek, thanks so much for coming on tonight. Walk us through what this is, how you administer it, what happens next.
So this is a rapid diagnostic test that will generate an accurate diagnosis within 5 minutes if the patient is positive for COVID and up to 13 minutes if they are negative. And it's the only test out there that's rapid in that degree of speed. How do you administer it? So the way it works is that Dr. Siegel here is kind enough to be our patient for this evening, and he had actually complained of a bit of a cough and is thinking about going back on the wards at NYU. So we thought it would be a good idea to definitively rule him out for COVID. And we're going to use the Abbott here and get a result within a few minutes. So the way it works is that we will swab him, and we'll do a nasal swab and put it in the instrument. And I'm just putting on my PPE here because this is a potentially infectious process, and we want to adhere to all of our PPE guidelines. So the first step here is that we will take a swab. Okay, so the swab's all set now, and we can
okay, so may I just ask you to pause there? So you didn't, I spoke to someone the other day who had one of these tests where the swab went all the way back into his throat. That's not necessary with this?
Yeah, so that's one of the beauties of this instrument is actually it is validated for nasal swabs. The swab that you're mentioning that goes to the back of the throat, that's called a nasopharyngeal swab, and that can be very uncomfortable for patients. And that's the main reason why healthcare providers, when we perform it, have to wear PPE because it can induce sneezing or coughing.
Right. Okay, so you're going to run that test and we're going to, will you have some sort of answer in 10 minutes, 15 minutes?
Yeah. In about 15 minutes, we'll put it in here. We'll run it. I'll show you how it works. So the test, basically, we open up this chamber, and we will put some reagent in the base of it. We'll swirl the swab around. It heats up. We move the testing device up into this top one. We close it, push the button, and walk away. And within 15 minutes, we will have a result for Dr. Siegel, and he can be off on his way. The beauty of the rapid test is that it can be used in multiple ways. At my particular hospital, we use it for inpatients. And for inpatients coming into the emergency room who need to be quickly assessed whether they have the infection or not, so that they can be placed in a particular area of the hospital, it's invaluable in that sense. And it conserves PPE because if we know who's positive and who's negative, we know who we have to be cautious about.
Well, it makes total sense. And we'll be back in just a minute to find out what happened in the case of Dr. Siegel. Doctor, thank you. Appreciate it. We've got a Fox News alert for you. Dr. Siegel's coronavirus test results are back. We don't know what they are. We're joined now by our chief medical correspondent, Dr. Siegel. He's back to tell us with the mask off. Dr. Siegel, you're smiling.
Tucker, that's a good sign. It's negative. And I want to tell everyone out there with a cough who's worried that they were in contact with people with COVID-19, this is where the future has to be. Boy, do I feel great. Boy, have I been worried for a week, not wanting to cough in public, not wanting anyone to know about it. You know what this means? I can go back to social distancing and not think so much about social quarantining, which is what I would have had to do if I were positive. Dr. Redfield of CDC, who I spoke to today, feels that this swab I did is just as accurate as the more invasive swab, which you asked. And Admiral Giroir of HHS said the same. same thing. The other test I'm doing tonight is that I'm having my blood drawn so that Dr. Misialek can check me for antibodies, and then I can see whether I'm immune or on the road to being immune if I had it already. That's the future here. We got to know, did I have it? Am I getting over it? Can I go back to society? If I have that information on everyone, and Tucker, look how long this took, not even the length of the show, and I know I'm negative. Wow.
Amazing.
That's got to be the future for our society. That will help us recover. That will help us recover.
For sure. It's a prerequisite to recovery. I must know 10 people who would like that test. Very quickly, how long till those 10 people can get it?
Well, let's hope within the next few weeks. We're being told that it will be rolled out very, very quickly. This test is limited because you can only do 4 an hour on this, right? But we need these all over the place. We have 18,000 of them in the country. We need 80, 100, 200,000 as soon as possible, or tests just like it for rapid test results, point of care.
Amazing. Abbott Laboratories. Good for them. Dr. Siegel, great to see you tonight. Thank you.
Very relieved. Thank you, Tucker.